$3 one day and $1,500 the next for a prescription drug. The government calls it a cost of living increase. A Lansing man calls it absurd. It's our lead story tonight. That cost of living increase is in his Social Security check and impacting what he can afford. Brian Johnson tells us why it's happening and if it could happen to others as well.
Give me my medications. Because I can live on that. I can't live on $21.
Frank Kudus is 77 years old. He lives with his son Jim, who is his primary caregiver. Together they both live on fixed incomes in an apartment building in West Lansing. They have plastic over their windows to save money on their heating bill.
Why in America can't people get their medications they need to keep them alive?
Last year it cost the Kudus family about $10 a month for Frank's prescriptions, but he recently got a cost of living increase from Social Security that disqualifies him for his previous medical coverage.
So instead of $10, now he's looking at $2,100. That's more than he gets for his Social Security check.
Frank gets about $1,500 a month from Social Security. He has no way to pay for the medications he needs to stay alive.
That's the bottom line. If I can't get it, I can't afford it, I can't take it. If I can't take it, the end result is I'll pass away.
It's a death sentence. He is already overdue to take one of his essential medications, but simply doesn't have the money.
Without that medication in the next couple days, he is going to drop off. He's going to be in the emergency room.
Joe Murphy works for a nonprofit called MAP that helps find solutions when people have problems with Medicare.
There's lots of places where things can go wrong.
She came with us to meet the Kudus family when she heard their situation.
I look forward to working with Jim and Frank. Hopefully we can get a good resolution for their problem.
In Lansing, Brian Johnson, Fox 47 News.
Frank and Jim Kudus aren't in the clear yet. Murphy says an error could be happening in a couple of different spots. If the letters from Medicare and Social Security are correct, they will have to find some other option.